We received this question. I took mushrooms on July 31st and had a great time. On August 2nd, I got hit with massive anxiety and it lasted a couple of days. Now I just have physical symptoms and I need advice on how to permanently fix this because it scares me and I'm not generally anxious. Well, first, recreational drugs, like mushrooms, affect how the brain functions. Since the brain is part of the nervous system, it also affects the nervous system. In many cases, recreational drugs stimulate the nervous system, which can lead to hyperstimulation and its symptoms. In this case, the recreational drug could have stirred up your nervous system enough to cause the physical symptoms you now have. Keep in mind the adverse effects of recreational drugs most often appear a day or so after taking the drug. This is like how alcohol affects the body. Second, while you might not perceive yourself as an anxious person, you could be and not be aware of it. In many cases, the appearance of anxiety symptoms is the first indication a person is anxious. This could be the case for you. You can take our free online anxiety test, anxiety personality test, and anxiety disorder test as well as others and see how you score. You would likely find the results illuminating. As for how to stop this, well, number 1, avoid recreational drugs. Recreational drugs always punish the nervous system. While you might not feel the effects immediately, you could a day or so later. Moreover, recreational drugs can lead to mental health issues, such as issues with anxiety. Recreational drugs aren't innocuous. They often adversely affect the brain. The more often the use, the more likely the adverse effects. And those who take recreational drugs often have mental health issues and don't realize it. This is a common scenario. Number 2, eliminate hyperstimulation. As hyperstimulation is eliminated, your symptoms will subside as your body recovers. As your body recovers, it stops sending symptoms. And number 3, seek therapy. Again, as mentioned, there's a high likelihood you are an anxious person. Working with an experienced therapist can help you understand your anxious behavior and help you address it so that it's no longer causing problems. I know this might sound presumptuous, but we've seen this scenario many times when someone didn't think they were anxious until symptoms appeared after recreational drug use. It's a common scenario. While that might not be in your case, it's best to find out now rather than later when anxiety, hyperstimulation, and their symptoms become a much larger problem. Doing this work now can prevent years of needless struggle. Without knowing much more, this is the advice I offer based on your brief comment and my many years working with anxious people who had their struggle with anxiety disorder started due to recreational drug use. Again, while this might not be the case for you, there is a strong likelihood it could be. Connecting with one of our recommended therapists would deny or confirm the possibility, and then at least you'd know.